Did you actually say who I am? I didn't hear that. Oh, right. Okay, mine. So I shall introduce myself. And I also want to congratulate Kathy on providing her absolutely excellent speech without any notes. And so here, I'm going to have to stand here because I do have my speech written up for me because I have not memorised what I would like to say. I'm Kylie Shae. I'm the team lead for Access to Assistive Technology at WHO. I have the great honour to lead an excellent team who are really focused on making assistive technology something that is integral to assistive technology for everyone, everywhere. And it's a real honour to be here and to speak to you, those of you in the room and to those of you who are online. So I began my career 30 plus years ago, an occupational therapist working in a school setting with children who had significant multiple disabilities. Most used wheelchairs, some struggled to sit up without support, and many were unable to speak. I always knew during my training that I wanted to be a paediatric therapist, and I took every possible elective that would help me to prepare for that role. However, the reality is, when faced with the number of children I needed to serve, the complexity of their needs, and in a context with very little supervision, I recall feeling very much at a loss. These children needed so much support, and I was one occupational therapist, a raw beginner, and so where to start? And so I took a breath and I decided to take my time to observe and to listen, to try to understand what was going on for these children and those around them to help me to prioritise. So I watched what was going on in the classrooms, in the lunchroom, the bathrooms, and on the buses each day. I sat with the children and I joined in with their activities. I visited them at home to get to know their families and how things were for them there. I listened to the parents, to the teachers, and I spoke with the therapists of the other disciplines. And I soon saw something that, to be honest, my training had not prepared me for at all. And that was the importance of assistive technology in every aspect of these children's lives, enabling their mobility, their social interactions, ability to get into the playground, to eat safely without aspirating, to sit independently on a toilet instead of having to wear a diaper, to make themselves heard. And yet, despite the fact that assistive products were ever present in the children's lives and impacted so much of what they could and what they could not do, there were challenges. The equipment was often in need of repair, or it was overdue for adjustment. Parents spoke of long waits between assessment and provision, or having to drive hours to our headquarters for specialist appointments for their children's equipment. And devices were often provided in isolation of each other. For example, support provided for a child in their wheelchair resulted in making it more difficult for them to access their communication device. And so there it was. I found my focus, and I embarked then on a journey of learning, and oh my goodness, fast forward 30 odd years, and I'm still on that journey. And so here I am today, having been invited to speak about assistive technology as an emerging health priority. And just that alone, having assistive technology and health priority in the same sentence, is an indication of just how much has changed since I joined this sector, back in a time where I'm not even sure it was called a sector. And this GDI Disability Summit, it's a great moment for us to reflect on some of those changes. So firstly, the range of assistive products available on the open market has increased dramatically. In contrast to when I began, when much of the equipment the children used was fabricated individually in a workshop by local technicians, there are now thousands of quality, ready-made assistive products available. But of course, these are only available to those with access to these markets and the resources or the support to acquire them. In terms of the workforce, we know we have a long, long way to go. But in comparison to when I began, the workforce engaged in assistive technology has expanded. There are professional associations for assistive technology providers. There are networks such as the WHO GATE initiative and others. There's more training available and more people specialising in the field, not only as clinicians, but also as advocates, product designers, researchers, system thinkers. The fresh graduate that I was in the late 80s would today have many, many more mentors, far more literature, and most importantly, far more experienced clients and families to teach her. And this is slowly becoming true, not just in high-income countries. And bringing us right to the here and the now, and considering that when I started there was no internet, digital technology is rapidly changing this sector. Not only are we seeing digital technology being used to bring smart, assistive products to the market, but it's also being used to improve the efficiency of provision, to reduce the barriers of distance between clients and the support they need, and to support and train personnel. And then one of the biggest, and I'd say seismic shifts, is that we've reached at last a tipping point where there are enough of us globally that fully understand that applying a charity model to assistive technology is simply not right. That is not to say that provision using a charity model, including mass donations of assistive technology, no longer exists. But the tide has definitely turned against this approach, and together we have the voice, the tools and the resources to call this out and support a system-strengthening, rights-based approach. And to put this in perspective, I spent most of the 90s living and working on this issue in low-income countries. I recall meetings with many of the big agencies, and I am not going to share names here, but trying to attract some attention, some resources to support systematic strengthening of assistive technology services. And I was told that this work was for charities. It was welfare, it wasn't development, or it was too hard, or it was too niche, or it was a distraction from the real development priorities. Looked at today, these same activities are now being embraced by the big agencies and by national governments, and quite rightly are attracting growing amounts of development assistance. The relatively recently forming of AT-Scale, established to create a pool of significant big donor funding in this sector, is an example of this shift and recognition. The disability rights movement played a key role in this transformation, and we all owe a debt and a great deal to the global, the national and the community leaders of this movement who truly have battled. But today we can confidently talk about assistive technology as a right and not meet resistance. We highlight the relevance of assistive technology within the context of achieving the Sustainable Development Goals and truly ensuring that no one is left behind. And in 2018, countries from across the globe, high, middle and low-income countries, endorsed the first World Health Assembly resolution on assistive technology and recognised its role in ensuring inclusion and participation for all in all aspects of civil life, and committing to actions to ensure access. And finally, in terms of what has changed, one of the greatest changes of all is our increasing understanding of assistive technology as a whole of population issue. Many of you will be very familiar with the 2022 WHO and UNICEF Global Report on Assistive Technology, which tells us that 2.5 billion people need assistive technology today. That is 1 in 3 of us. And this includes people with disabilities, like the children I worked with many years ago. But it also includes people like myself who use glasses or contact lenses to correct refractive error. It includes people with short or long-term health conditions impacting their function. And overwhelmingly, it includes older people who are in fact statistically the largest group of assistive technology users, with 2 out of 3 people 60 plus years old using assistive technology. And this shift is key because it can no longer be argued that the provision of assistive technology is niche service. And it creates the opportunity to use a whole of system approach to address the need that benefits all. So, is assistive technology within health systems an emerging priority? Absolutely. And the World Health Assembly resolution, the Global Report on Assistive Technology already mentioned, as well as the other tools and the resources developed by WHO to support member states in integrating assistive technology services into their healthcare systems, including the first priority assistive product lists and data collection tools. They are testimony to this. And even better, the resolution, the recommendations and the tools are transforming into action. And as an example, I'm very proud and happy to say that on my way here this morning, I took a call giving the green light to initiate procurement for assistive technology in response to the emergency in Morocco. So within 5 days of the earthquake that has had such a devastating impact in that country, decisions have already been made by the Ministry of Health in Morocco that are inclusive of the rehabilitation needs of those injured, including early provision of assistive technology. And this is not isolated. We're also responding to another current emergency in Sudan, where the green light also received just this morning to go ahead with procurement. So this in itself demonstrates how far we have come. Assistive technology is well recognised today as an integral component of universal health coverage, and it's relevant across the continuum of healthcare, including prevention, treatment, rehabilitation, palliative and long-term care. Recognising this as a priority is a big step towards achieving universal access, but there is a long road ahead. We know that those who use assistive technology are a hugely diverse group of people in need of an immense range of different products and associated supports. Our needs are not homogenous, and this presents challenges for a systematic provision. Some of us can have our assistive technology needs met relatively simply, whereas others need more complex interventions requiring specialist equipment and the support of personnel with particular expertise more often. And so in responding to this emerging priority, at a point in time where resources, including human resources, for health service delivery remain insufficient, where the global community is facing the biggest challenge we've ever faced in the context of climate change, where we know we are collectively lagging in meeting the Sustainable Development Goals, we need to think differently. And in the minute or so, I hope, remaining to me, I suggest we need to break down the silos of service delivery that have developed over time to meet the different assistive technology needs, because without a broad whole of healthcare approach, where the different roles in identifying, referring and meeting assistive technology needs are shared amongst health personnel and across the health system, from the community, primary level through to tertiary services, we are going to continue to fail to meet the need and people will fall through the gaps. We need to step up technical and financial assistance to low and middle income countries to help them to strengthen their health systems. Health leaders in these countries endorsed the World Health Assembly resolution on assistive technology. They recognise this as a priority, but they can't do it alone. We need to further embrace and develop the potential of digital assistive technology, because this has the capacity to reduce the cost of provision and, most importantly, to reduce the significant barrier of distance to services. And finally, as this sector picks up pace and the work intensifies, as a community of individuals and organisations, we need to do what I did over 30 years ago. We need to take a deep breath. We need to survey the landscape. And in doing so, we need to recognise and we need to capitalise on our different strengths, expertise and perspective to create an efficient, streamlined and collective effort that is characterised by collaboration, not competition, to support and respond to this emerging priority. In this increasingly, fortunately, increasingly busy space, let's avoid overlap and duplication. Let's be efficient. Do what you do well. Join forces with others to make sure all the bases are covered. And most importantly, follow and support the national leads and the duty bearers in each country, because this is what will achieve sustainable change. And so in closing, I would just like to say that I hope it will not take another 30 years before we can drop the word emerging and simply say that assistive technology is a health system priority. Thank you very much.
Thank you so much, Kylie, for that fantastic contribution.